To what extent do you measure and treat DHEA and pregnenolone with your patients? Are they routinely checked or only when there is difficulty getting someone dialed in?
DHEA and pregnenolone tend to be slightly pricier lab tests for guys that have insurance-based labs. If they wish to run them, no problem. What I find is a lot of guys, usually when they begin TRT, they're okay initially. After a while, 6 months, a year, usually the pro-hormones upstream from testosterone, like DHEA and pregnenolone, they do tend to come down a little bit. When do we treat them? Is when someone becomes symptomatic. If someone complains that their sleep has suffered, we will often look at pregnenolone, which converts to progesterone. It's got a calming, soothing effect that helps you fall asleep at night. You will dose them until they get sufficient sleep without feeling groggy in the morning. So we use more of a feedback approach to dosing rather than a lab value per se. When you're looking at DHEA, some guys will develop desensitivity during sex, and they will have an inability to achieve orgasm. It's called anorgasmia, or they will have a delayed orgasm effect, which is the opposite of premature. And that in itself causes frustration, problems, lowers libido because it adds anxiety to the process. In that case, usually DHEA, if in fact deficient, will help resolve that issue. So 25 milligrams dosed in the morning. With pregnenolone, we'll usually start at 10 milligrams dosed before bed. But it is patient specific. Sometimes it's based off labs, but more often than not, it is based off of symptoms. And I know Dave Lee loves to research those pro-hormones extensively, and he would be a better option than myself to discuss them.
If you wish to support the channel, consider becoming a channel member. And check out the links in the description of all the things I'm associated with. My ebook on compounded testosterone cream, multiple workout programs, Mizumi skincare, online pharmacy NP labs, and a list of Amazon links to the supplements we recommend.